Approved use. Aimovig, erenumab-aooe, is a prescription medicine used for the preventive treatment of migraine in adults. Important safety information. Do not use Aimovig if you are allergic to erenumab-aooe or any ingredients in Aimovig. Please see additional important safety information later on in this video.
We're hearing blue jays. The call, I read as a child that the call that they make says thief, thief, when they're flying through the air and communicating with each other. I work as an accountant. It sounds boring on paper, but I find the problem-solving nature of it to be very fulfilling. In my spare time, I love doing genealogy and photography, and most importantly, birding. To take good photos of birds, you have to be where the birds are, even if that involves travel. You have to be there when they're there, even if that involves getting up at 3 or 4 in the morning. There was a time when I couldn't do that reliably. Taking Aimovig and having fewer migraine days, it has opened up the world of birding photography to me. I never realized how much I would enjoy it. Bill comes with me about half the time. We can enjoy nature together. We can share the birds together. I enjoy watching the birds. I enjoy anticipating what their behavior will be. And the accountant in me really likes counting the birds. When I first realized how many fewer migraine days I was having, I was a little afraid it wouldn't last. But they have held for me, and I've been really pleased with that. It's been a whole new chapter in our lives. We had taken one of my granddaughters on a trip to go birding one morning. We weren't really seeing the birds that I'd hoped we would, and I apologized to her, and she looked at me with a sweet smile and said, "Nana, I'm doing this for you, not for the birds." And it just really made me happy that she was willing to give up sleep just to be there with me. It's really a blessing to be able to know that I can more reliably plan to do something with my granddaughters or my daughters or my husband. It became a possibility that it's not going to be a migraine day that keeps me from doing what I need to do with my family, my friends, or my job. My name is Karen, and I've been taking Aimovig since 2018.
Important safety information. Who should not use Aimovig? Do not use Aimovig if you are allergic to erenumab-aooe or any ingredients in Aimovig. Before starting Aimovig, tell your healthcare provider, HCP, about all your medical conditions, including if you are pregnant or plan to become pregnant, breastfeeding, or plan to breastfeed. Tell your HCP about all the medicines you take, including any prescription and over-the-counter medicines, vitamins, or herbal supplements. What are possible side effects of Aimovig? Aimovig may cause serious side effects, including allergic reactions. Allergic reactions, including rash or swelling, can happen after receiving Aimovig. This can happen within hours to days after using Aimovig. Call your HCP or get emergency medical help right away if you have any of the following symptoms of an allergic reaction: swelling of the face, mouth, tongue, or throat, or trouble breathing. Constipation with serious complications. Severe constipation can happen after receiving Aimovig. In some cases, people have been hospitalized or needed surgery. Contact your HCP if you have severe constipation or constipation associated with symptoms such as severe or constant belly pain, vomiting, swelling of belly, or bloating. High blood pressure. High blood pressure or worsening of high blood pressure can happen after receiving Aimovig. Contact your healthcare provider if you have an increase in blood pressure. The most common side effects of Aimovig are pain, redness, or swelling at the injection site, and constipation. These are not all of the possible side effects of Aimovig. Call your HCP for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch. or call 1-800-FDA-1088.
My favorite bird is the pileated woodpecker. They're beautiful. They have an obnoxious call that almost is blood-curdling. This is it, the pileated woodpecker. It's always a treat to see one. You usually don't see a lot of them at a time, and you may not see one every trip, but they're beautiful and interesting, and I love them.